It is January 13th, 2021. And in this video, I'm going to go over the latest details about the CDC's order from yesterday requiring all air passengers to the United States to have a negative COVID-19 test. Follow along. Okay, good morning, good evening, good afternoon, wherever it is you're located. In this video, again, I'm going to read the details of the CDC's order that was just placed earlier tonight. It is late that night. I had to read this entire order. It's only 10 pages, but I wanted to pull out some details for you because it has some pertinent information that you're going to want to know. Looks like half you guys are saying, man, screw it, you're out. You don't even want to fly anymore. But I mean, don't just give up that easy. Let's look at the details for some of it. But first, I want to go over a story that I have to read. It's a short one, but it's kind of unnerving. It irked me anyway when I read it. So here you go. It states, foreigner who traveled to the country with COVID-19 could have legal sanctions. Authorities have already notified the airline and the other passengers on the flight. Shame. And this is Colombia. Director of Migración Colombia, Juan Francisco Espinosa, confirmed that at dawn this Wednesday, a U.S. citizen arrived in El Dorado International Airport who said he had a positive test for COVID-19. The foreigner was removed and isolated immediately prior to his arrival at the immigration control filters, while the airline transporting him was notified of what happened. Given this fact, Espinosa warned that if the positive result for COVID-19 is corroborated by the health authorities, the foreign citizen could be immersed in administrative and legal sanctions for putting health security at risk from the country. He also warned that these same sanctions would be carried out against some airlines that transported him to this country without carrying out the necessary verifications. He also explained that in the last week, more than 39,000 people had arrived in the country, and there have been 2 cases that have required isolation by the health authorities. However, and despite the fact that only 2 cases have been presented in more than 39,000 travelers, we call on citizens so that if they have symptoms related to COVID-19 or are positive for the virus, they refrain from traveling, he concluded. So, somebody from America, and I hope it wasn't one of you guys. I hope it's not my viewer. So, if you are this person or you know who this person is, let me know. And this just happened. So, this is dated today. So let's do some detail work on this. Anyway, let's jump to the actual order by Robert Redfield, the head of the CDC. It's entitled Centers for Disease Control and Prevention, Department of Health and Human Services, order under section yada, yada, yada of the Public Health Service Act and 42 Code of Federal Regulations and so on, requiring for negative pre-departure COVID-19 test result or documentation of recovery from COVID-19 for all airline and other aircraft passengers arriving into the United States from any foreign country. So here we go. I've highlighted, I'm just going to go over a little bit of it. I'm going to go as quick as I can, but I highlighted some of these that you're going to want to pay attention to because these are questions that are going to come up. Now, remember, I don't have all the answers. I'm doing this research as best I can for you guys. I need the feedback from you guys to give me this information because the biggest takeaway that I did not recognize right off the bat was from one of my subscribers, was from Gary. So shout out to Gary, appreciate that heads up. Because I had scrolling along the bottom that they are requiring a PCR test and they did not mention PCR. And you'll see when I get a little bit further down, what he brought to my attention was that it's going to either be a PCR test or a rapid test. So let's read further down. The negative pre-departure test must be a viral test that was conducted on a specimen collected during the 3 calendar days prior to the flight's departure from a foreign country. Qualifying test, it's stating. Alternatively, it is the passenger has recovered from COVID-19. The passenger may instead travel with written or electronic documentation of a positive viral test that confirms previous SARS-CoV-2 infection and a letter from a licensed healthcare provider or public health official stating that the passenger has been cleared for travel. So what this is saying is, to me, and again, I'm not an attorney, but I'm doing my judicial due diligence. And from just reading into it, it looks like that if you've had it already, they're going to let you come. You need to show that you had that you were positive over, and it's going to go into details on the timeline a little bit further down, but you need to show that you had it in prior months, and you have a written letter from a medical authority stating that it's okay for you to fly, that you are fit to fly. So a passenger must retain written or electronic documentation, which is good. I always get the question, do you know if you can look at your phone? Well, now they're going to let you pull it up on your phone. My guess is they would have some kind of barcode. Otherwise, anybody can put anything on their phone. But there are penalties for lying about this and, bringing up fake negative results. So don't do that either. Okay, documentation presented in an airline and aircraft operator. A passenger must also provide such qualifying test results or documentation of recovery upon request to any government official or cooperating state or local public health authority. What this says to me is everybody in the airport has a right to ask you, the baggage claim people, whoever, everybody has the right to ask you. So if you get asked, they can demand that you show this. New times we're living in, guys. At least you don't have to take your shoes off. Well, I don't take my shoes off. Anyway, this order supersedes the previous order signed by the United States Center of Disease Control and Prevention on December 25th, and this was regarding the flights from the United Kingdom. Airline or other aircraft operator must verify that every passenger 2 years of age or older. So if you come with your 5-year-old, you're coming back to the States from wherever, Guatemala, Costa Rica, Europe, anywhere, and your child is over 2 years old, they need to have a negative test result also. 2 years of age or older on board the aircraft has attested to receiving a negative qualifying test result or to having recovered from COVID-19 after previous SARS-CoV-2 infection and being cleared to travel by a licensed healthcare provider or public health official. Airline or other aircraft operator must confirm that every passenger on board the aircraft has documentation of a negative qualifying test or documentation or recovery of COVID-19. So I'm going to guess the airline industry is up late like me, and they're studying on how to look at these test results, what to look for, because it's not just a test result that you're going to need to show, and I'll show you in a minute. The CDC encourages airline and aircraft operator and incorporated the attestation into paperless check-in process. Now, an attestation is you certifying that you don't have it, that you feel well. And I'm going to assume that it's kind of along the lines of the check MIG that you're using to get to Colombia, only it's going to be one for us. So there'll be some sort of app, and I guess the apps will have to be created, and that's basically what it says. But airline and aircraft operators have sole legal responsibility to provide and collect attestations and ensure the accuracy of any translation and to comply with all other obligations under this order, which just triggered something for me. Translation, what if it's in another language? There's going to be some challenges for the airline industry, but they're under the gun right now, and they do need the passengers. So I guess more people are willing to fly. I mean, I'm more willing to fly knowing that everybody on the flight has it. I just don't want to transfer. If I can get a straight shot, a cheap straight flight, then I'm gone somewhere, but that's just me. So qualifying test results means confirmations that, one, the personal identifiers, name, date of birth, on a negative qualifying test result match the personal identifiers of the passenger passport or other travel document. So they're going to pull up this form, and they're going to pull up your picture, and they're going to compare. If the passenger is arriving on a direct flight from the United States, the specimen was collected within 3 calendar days preceding the flight's departure. I know. 3 days, 4 days, it doesn't matter. You can catch the virus within 3 days, 2 days, and that last day you can catch it. So, but can you transmit it at that short period of time? I don't know. If the passenger is arriving via one or more connecting flights, the specimen was collected within 3 calendar days preceding the departure of the initial flight, but only if the connecting flights were booked as a single passenger record with a destination in the United States. B, each connection is no longer than 24 hours, and C, the airlines or aircraft operator has instructed the passenger to comply and uses reasonable efforts to facilitate compliance. So they're taking into account you're coming from the Philippines or Korea, and you may have more than one flight. You just can't have more than a 24-hour layover during the meantime. So now I highlight this one in blue because it's a big one. The test performed was a viral test as defined below. So the test result states negative. It has to say negative. It has to say SARS-CoV-2 RNA not detected. That's the second option. Or it has to say SARS-CoV-2 antigen not detected or COVID-19 not detected. A test marked invalid is not acceptable. So you have to have one of those four things: a negative, or not detected, or antigen not detected, or COVID-19 not detected. It has to say that on the reports. Of course, it has to have the details, the doctor's name, your name, just like it does right now. So confirm that a passenger alternatively has written or electronic documentation of recovery from COVID-19, meaning confirmation that. So here it is. If you've had it before and you no longer have it now, the passenger has, this is one, the passenger has presented documentation of a positive test result and a signed letter on official letterhead that contains the name, address, and phone number of a licensed healthcare provider or public health official stating that the passengers have been cleared for travel. 2, the positive test result occurred within the last three months, 90 days, preceding the passenger's flight to the United States, or at such other intervals as specified by CDC guidance. So within the last 3 months, you had to have had it within the last 90 days, and you have to have a written letter from a healthcare professional. The personal identifiers, name, date of birth on the positive test results and signed letter must match the personal identifiers. Of course, they're going to verify that it's you. And the test performed was a viral test as defined below. The test results state positive, or just the opposite of above. This test result has to say positive, has to say that it detected it, has to say that an antigen was detected, and that COVID-19 was detected. So the thought behind it, I would assume, is that, okay, you've had it already, so you built up the antibodies for it, so you can no longer get COVID-19. And then your doctor just has to say, okay, it's okay for you to fly, you're fit to fly. Okay, now drew arrows in here for a reason. Viral test means a viral detection test for current infection, i.e. a nucleic acid amplification test. I had to look this up just to be sure. I don't want to tell you stuff I'm not sure what it is, but that's the PCR test. So you can still do a PCR test. That's an option. Or a viral antigen test. The antigen test is the rapid test. So you can do the rapid test. I'm telling you, like I told you guys earlier tonight, you are going to see these in airports all across the country, all across the world. Watch. And it's going to end up being for domestic travel too. Watch what I tell you. Remember this, January 13th, DC Born Rob told you this, that they're going to check this stuff. It's going to be, a $20 fee added onto your flight. Some airlines are already doing that. Or they're going to charge you at the airport $20. You can get a bag of cookies and a rapid test. Mark my words. Okay, so it has to be either a PCR test or a rapid test. So you're no longer committed to having the PCR test and worrying about and stressing to get that test in time. So really, you can do it that same day. And it makes sense to do it either the day before or that same day, because then you're within 3 days and it's tested you one more day before you left. The following categories of individuals and organizations are exempt from the requirements of this order. Now, I highlighted in this one in blue because this is a challenge for me. Okay. Crew members, this is people who are exempt. Crew members of airlines or other aircraft operators, provided that they follow industry standard protocols for the prevention of COVID-19 as set forth in relevant safety alerts for operators. Okay, what's that? I mean, even if they know, I would like to know, what is that? What are they doing? Why don't they have to take tests? Are they just back there washing their hands and they're coughing? Are they coughing in their washed off hand? What's up? So airlines or other aircraft operators transporting passengers with COVID-19 pursuant to CDC authorization in accordance with the CDC guidelines. So who is this? So a pilot is off duty and he can go on. Now I have a pilot who's one of my viewers, and he says that he gets the test done I don't know if it's a mail-in one and he sends it in, but he uses that. The next one says federal law enforcement personnel. So here we go. Federal law enforcement personnel while on official duty and carrying out the law enforcement function and members of the U.S. military. So what is that? Okay, so they're transporting a prisoner. That's the only thing I can guess. They're transporting a prisoner and they don't have to have a test. Okay, well, does the prisoner have to have a test? Does he have to have a negative test result? But the cop doesn't? I don't agree with that one either. Get your cops to take a test too if we got to take it. It's on the same plane. Your whole point is moot if you allow anyone on there that hasn't taken the test. That's just me, okay? All these are my opinions, so you can't disagree. Federal law enforcement personnel while on official duty carrying out the law of enforcement function of members of the U.S. military. Okay. Airlines or other aircraft operators granted specific waivers from the application for this order based on CDC's determination that the foreign country lacks available COVID test. So you can come from a country, it's hard to get a test. That's okay. Yeah, we know certain countries. Now, I want to know what countries they are. Now, if anybody knows that list or find that list, or because you guys are smart, you guys give me more feedback. You tell me what I'm missing. That's for sure. Okay. So background, I'm going to skip through. I think that is okay. A couple more things. Okay. Let's see. Must take a dual approach to combating the virus. This means concurrently mitigating and slowing the introduction and spread of SARS-CoV-2 and controlling transmission within the U.S. communities that are currently being overwhelmed from a surge of infections. I get why they're taking it. But for persons previously diagnosed with COVID-19 who remain asymptomatic for recovery, CDC does not recommend retesting within 3 months after the date of symptom onset. So if you've had it within 90 days, they're saying that you don't have to take the test again. Or date of first positive viral diagnosis test if their infection was asymptomatic. So they're asymptomatic and they just happen to get a test and find that they were positive, then you don't need to do it again within 90 days. I mean, did he write this or did his lawyer write this? The guidance may be updated as additional information about people who have recovered from COVID-19 becomes available. In other words, they're guessing. I mean, it's logic. They're using logic as best they can, except for letting people on who are government officials and so on. But pre-departure testing does not eliminate all risk. However, when pre-departure testing is combined with all other measures, such as self-monitoring for symptoms, wearing masks, social distancing, and hygiene, it can make travel safer by reducing spread of conveyances. I do. Yes, I do. I take everything. I'm masked. I'm the one that's wiping down things. I'm that guy. Requirements for airlines and other aircraft operators. So any airline or other aircraft operator with passengers arriving in the United States from a foreign country, for passengers on board the aircraft arriving to the United States shall verify each passenger has attested to having received either a negative qualifying test result or recovery from COVID-19. Airlines or other aircraft operators must retain a copy of each passenger's attestation for 2 years. So the form that you're going to fill out, whether electronically or paper, they're going to keep on file for 2 years. Yeah, they got this. The airlines confirm that each passenger aged 2 years or older has documentation of a negative qualifying test result. Not board any passenger without verifying the attestation and confirmation of documentation set forth. So there's two things. You need the negative test result, and you also need this attestation, which can be electronic or paper. And I'm assuming, I believe the test can be electronic or paper as well. So that you need to just fill out, I guess there's an app they're going to create that says, okay, I don't have this, I'm not sick, just like the check MIG if you've gone down already. Okay, requirements for aircraft passengers. Any aircraft passengers departing from any foreign country with a destination within the United States provide an attestation to the CDC through the airline or other aircraft operator of having received a negative qualifying test result. So you have to get the test result Then you, just like the checkmate, I guess 24 hours before your flight, you log on and say, okay, I have my test result. An infection clearance to travel. The attestation is attached to this order for attachment A. Okay. CDC may modify this order by an updated publication in the Federal Register or by posting an advisory on their website. So the attestation, what does it look like? This is it. It's just 2 pages, but just briefly, I'm going to run through. Each individual 2 years of age or older must provide a separate attestation. A parent or legal guardian must attest on behalf of the passenger aged 2 to 17 years. An individual may attest on behalf of another passenger for whom the individual is authorized to submit the required information. Under United States federal law, each passenger must provide this attestation. Failure to provide this attestation or submitting false or misleading information could result in delay of travel, denial of boarding on future travel, or put the passenger or other individual at risk of harm, including serious bodily injury or death. Any passenger who fails to comply with these requirements may be subject to criminal penalties. So don't create your little fake deal. Yeah, man, look at it. It say, negative. Look, something you wrote or you printed out in Word. Don't do it. Don't do it, dude. Okay, passenger attestation requirement has the name or authorized representative. I have to read this disclosure pertaining to my obligation to obtain a negative pre-departure test result for COVID-19 in order to board any aircraft departing from the UK and arriving in the United States. They need to change that. That's for everybody. I attest that you can see they've used this before. They just didn't change it. I attest that I have received a negative pre-departure test result for COVID-19. The test was a viral test that was conducted on a specimen collected from me during the 3 calendar days preceding the flight's departure. So again, that's the details from the CDC's order. And this is the attachment, which is an attestation. Why am I struggling with this? Attestation is, I've never said this word before that I can recall, but it's kind of like, I guess, if you go into another country, you go into Mexico and you get that little form, you need to check. Only you're going to do it prior to your flight, just like the checkmate. You do it online and say that you have had your COVID-19 test and you're straight. So don't let this stop you from flying. I mean, you're going to go, if you're not worried about the virus. I'm more concerned about the virus than the fee and the hassle. I mean, flying is a hassle. I've flown for a living for 10, 15 years now, or almost 20 years. Yeah, 20 years and a couple flights a month. And I'm a known traveler too, so I don't have to take my shoes off and all that stuff. But hopefully they'll incorporate that with the known traveler status or the global entry, if you have global entry. So when you're coming in the country, you don't have to worry about it. They can put it on your information somehow. So when they scan your passport, it'll say, you're okay, you're straight. Maybe they can tie the test into that somehow. Somebody's going to have to come up with some programs, some apps to make all this work. But rest assured, the airline industry is up late with me tonight studying this stuff. How are we going to look at this? But it should increase their business overall. But maybe not. According to some of you guys going to Colombia, you're not going to do it. But if I'm offering any information of benefit, do me a favor, go down and hit the subscribe button, click the bell to be alerted of any new news. And thanks for watching. Be safe.
We have a YouTube channel. Like it. Please comment and share if you like the video. Please subscribe and kick the bell.